Hi, Mary.
Hi, Jean.
I am really excited to be interviewing you. You've been one of my role models and one of my just following your career has always been an amazement to me. So, why don't you tell me a little bit about your background, how you came to do the work you did in our NP practice back in the 80s,
Mm-hmm.
and we'll start with that.
All righty. Thank you. In the late 80s, in the early 80s, 1981, I finished the Family Nurse Practitioner program at Northeastern, and I was living in Conway, New Hampshire at that time. There were no other nurse practitioners, so the New Hampshire Nurse Practitioner Association really became my support system, and looked forward to those monthly meetings on Saturday morning at the Concord Clinic. It was a very interesting support group. Um, and I worked in family practice for a couple of years, and then the physician that I was working with decided to leave the Conway area, and there was really no home for me after he left. So I started working at a children and youth project, and then worked at family planning. And we got a grant to do a demonstration project for first time in at-risk moms. I started doing a lot of prenatal care and decided to go back and get a second advanced practice degree in midwifery at the University of New Jersey School of Medicine and Dentistry. So that was the beginning of my clinical career, but there were huge roadblocks into being able to practice in New Hampshire around third-party reimbursement and prescriptive authority. And so um, people used to joke that my fourth child was third-party reimbursement. And I think for a long time that it was, but it really was the time in the 80s and 90s that we were able to move the bar consistently forward for full scope authority in New Hampshire. And there are certainly major hurdles that happened. Third-party reimbursement was successful, but not all the insurance companies wanted to play by the state rules, especially HealthSource that took forever to change. And then when the change happened, it was north of Concord for several years before it was statewide. We had the luck of working with a great Medicaid department that from the very beginning did full reimbursement for nurse practitioners once the third-party legislation was put through. And during that same time, I was able to work nationally with the American College of Nurse Midwives to obtain Medicaid reimbursement nationally for nurse midwives. So those were, really big events that happened and were part of the story of my professional career.
I want to ask you your education at Northeastern and then coming into the state or being here in the state as you went to school. When was the moment you realized, or when was maybe a story about when you realized those barriers of third party reimbursement and prescriptive authority? How did you tell me about when that realization came about what you needed to do in that policy arena?
Well, I think that we all know that time is money. And so if you weren't able to get paid for what you were doing, it was a definite barrier to being able to practice at the full potential of a nurse practitioner. And it set up a hierarchy structure within a practice that if you were billing under the physician's name, that then they still were the person in control of your practice. So getting independent reimbursement was important to be able to move forward to have independent practice. The prescriptive authority was just a very difficult situation where people were either using pre-signed script pads or people were getting each prescription signed. I used to say to students once we had full scope authority, there was a time when I had to get a physician's signature for Tri-Vi-Flor. I said, you can imagine how crazy that was. So it just, set up a hierarchy and a structure that just wasn't necessary. People, if you could do pre-signed pads, you could really write the prescriptions yourself. So I think that was the
Yeah.
moment.
So how much of the leading group that worked with you on the incredible change that we experienced in the 80s and into the 90s in NP practice were a result of that Saturday morning group that met, that was the sort of the foundation of the the New Hampshire Nurse Practitioner Association? Yeah.
I would say those were the people.
Yeah.
Yeah. Those meetings were
Yeah.
the strategy and the work that
Yeah.
got done. Yep. So, and people were just determined
Yeah.
that this was going to happen.
So you then made a transition or integrated midwifery practice, nurse midwifery practice into your FNP practice.
I did.
And that created another big opportunity for you. So share with me what happened after that point when you had both those skill sets and that knowledge base.
Lakes Region Healthcare was ready to open a midwifery service, and I needed to be somewhere where I was welcomed, and the Conway area was still not welcoming. So we made a decision to move to Moultonborough, and then I joined the medical staff at Lakes Region, and was in a place where I was really able to contribute, starting a midwifery service at a hospital, obtaining medical staff privileges, putting the things in place for medical staff privileges, voting privileges, and then finally having, only in the last few years, a nurse practitioner sitting on the executive committee. So those were, huge jumps of things that happened. But
I think the New Hampshire Nurse Practitioner Association, which is inclusive of CNMs as well, really benefited from your work in creating that opportunity to be engaged in hospital practice, to be part of medical staff. We were all looking towards that, but I just want to commend you for having actually made that happen and be one of the leaders in the state for working on that process. It's pretty incredible what you've done in your career. I have to also ask that she was also the primary care provider for my children when they were very young, and my husband got to know her very well. Our illnesses and well child visits. So I want to thank you for that.
Oh, thank you. I think it's been an incredible professional journey, and I've had the opportunity to work with unbelievable nurse practitioners and colleagues that have really brought out the strengths and the best that I had to bring to the profession. But those people really help support, frame, and move the issues forward. We all work together really hard.